Something is happening inside your body right now that most men over 60 never get told about. Not by their doctor, not by their wife, not by anyone, and it has everything to do with something you do regularly, maybe even daily, something you've never questioned because nobody ever gave you a reason to, until today. Here's what I need you to understand before we go any further. There's a pattern I see in my clinic constantly. A man comes in, he's been doing the same thing for decades, same habit, same frequency, same routine. He thinks he's fine, he thinks he's healthy. And then I run a few questions, and what I find stops him cold because the habit he thought was helping him was slowly, quietly doing the opposite. And the worst part? His body had been sending him signals for months, maybe years. He just didn't know how to read them. Today, I'm going to tell you exactly what daily ejaculation does to the male body after 60, not the version that sounds politically correct. Not the version that dodges the hard stuff, the real version, the one I give my patients when the door is closed and there's no reason to hold back. Because you're a grown man, you've earned the truth. I am Dr. Natalie Parker, and if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Now let's get into it, because what I'm about to show you in the next few minutes may completely change how you think about your own body. Let me start with the question that brought you here. What actually happens when a man ejaculates every single day, year after year, especially once he's past 60? Most men have two beliefs about this. Either they've been told it's great for you, do it as much as possible, it keeps everything working, or they've been told it drains you, weakens you, wears you out faster. And both of those answers are incomplete. They're too simple. And simple answers about complex biology are almost always wrong in ways that cost you. Here's what I know from 10 years of urology. The men who struggle the most aren't the ones who do it too often or not enough. They're the men who stopped paying attention to what their body was actually telling them. And that's the real problem we're solving today. Let's start with the biology. Because once you understand what's happening inside, everything else makes sense. When ejaculation occurs, your brain goes through a very specific sequence. Dopamine floods in first. That's your motivation and reward chemical, the same one that fires when you eat something you love or solve a problem. It creates a sharp, temporary high. Then oxytocin follows. That's the bonding hormone. It promotes calm and a sense of connection, even if you're alone. Then endorphins, your body's natural stress reducers. And finally, prolactin rises. That's what creates that settled, relaxed feeling afterward. Your heart rate increases. Blood flow improves in the pelvis. Your prostate empties stored fluid. Your pelvic floor contracts and releases. For most men, this sequence is healthy. It supports circulation. It can reduce stress. It can help with sleep. Regular ejaculation has been linked in multiple studies to lower prostate cancer risk, especially in men under 50. But here's where it gets more complicated, and this is the part nobody tells men over 60. After 60, your body's recovery cycle is not what it was at 35. Testosterone levels have dropped, not dramatically in most men, but enough to change the equation. Muscle recovery is slower, your nervous system is more sensitive, and the energy it takes to fully reset after sexual activity takes longer to replenish than it did 20 years ago. That doesn't mean daily ejaculation is automatically harmful, but it does mean that if you're pushing the same frequency you had at 45 without paying attention to how you feel afterward, you may be running a deficit without knowing it. Think of it like exercise. Running 5 miles a day at 40 might leave you feeling strong. Running the same 5 miles at 65 without adjusting your recovery, your sleep, your nutrition might slowly grind you down. Not immediately. Gradually, quietly. Your body doesn't always send alarm signals. Sometimes it just starts getting quieter, and that's the signal most men miss entirely. Let me ask you something. After ejaculation, how do you feel? Not right after. Not that first minute, I mean 2 hours later, the next morning, later that day. Do you feel clear? Energized? Like you slept well and woke up yourself? Or do you feel drained? A little foggy, less motivated than you'd expect? Maybe a dull pressure in the lower pelvis that you've been explaining away for months. That question matters more than any study I could quote you, because your body is the most specific data set that exists for your individual health, and most men have been trained to ignore it. Here's what I see in my practice every week. I have two patients, both in their mid-60s. Both came to me within the same month. Both told me they were sexually active almost daily. The first man looked good, slept well, woke up with energy, no urinary symptoms, no discomfort. His pelvic floor was healthy. His prostate showed no signs of irritation. For him, daily activity was completely fine. His body was recovering well. He wasn't running a deficit. He didn't need to change a thing. The second man told me almost the same story on the surface. Daily activity, long habit, felt normal to him. But when I asked him those same questions about how he felt afterward, the answers were different. He was tired in a way he couldn't explain, getting up 2-3 times a night to urinate. Lower energy in the mornings, a persistent tightness in the pelvic area that he'd started to think was just aging. Same habit, completely different outcome. Why? Because the body isn't a machine that responds the same way every time, for every man at every age. There is no universal rule. There is no magic number. There is no correct frequency that applies across the board. What there is feedback, and feedback only works if you're listening. The problem isn't daily ejaculation itself. The problem is the 5 specific mistakes men over 60 make that turn a potentially healthy habit into something that quietly works against them. And the most damaging one is number 1 on that list. But let's go through all 5, because each one builds on the last. And by the time we get to the first mistake, it's going to hit differently than you expect. Mistake number 5. Treating frequency like a fixed rule instead of a flexible response. This is where most men start going wrong. They land on a number. Every day. Every other day. 3 times a week. Whatever it is. And they hold that number like it's a prescription. Like deviating from it means something is broken. But frequency is not a rule. It's a response. Your body's ideal rhythm changes based on sleep quality, stress levels, physical activity, nutrition, hydration, age, and dozens of other variables. A week where you slept badly, worked long hours, and skipped the gym is not the same week as one where you rested well and felt strong. When you ignore those variables and stick to the same number regardless, you're not listening to your body. You're overriding it, and over time, overriding the body has costs. What I tell my patients, track how you feel for a week, not what you did, how you felt afterward. Notice patterns. That data is more valuable than any article you'll find online. Mistake number 4. Using ejaculation to manage stress or loneliness rather than genuine desire. This one is harder to admit, and that's exactly why it does so much damage. The dopamine response to ejaculation is real. It temporarily reduces cortisol. It creates a brief sense of calm. And for men under chronic stress or social isolation, which is far more common over 60 than most people admit, that temporary relief becomes a coping mechanism. Not because you're weak, not because something is wrong with you, because the brain is incredibly good at finding shortcuts to feel better. But here's what happens when ejaculation becomes a stress management tool. Dopamine tolerance builds. The same behavior produces less reward over time. So frequency increases, satisfaction decreases. A quiet guilt can start accumulating. Not moral guilt, just the low-grade feeling that you're going through the motions without knowing why. And the stress that triggered the behavior in the first place? Still there. Untouched. When I ask men in this situation what they actually needed in that moment, the answers are almost never what they acted on. They needed to sleep, to talk to someone, to feel productive, to feel like they still mattered. Before the habit kicks in automatically, ask yourself one question. What do I actually need right now? The answer might surprise you, and it might tell you more about your overall health than any lab test I could run. Mistake number 3, ignoring what your prostate is telling you. The relationship between ejaculation and prostate health is one of the most misunderstood topics I deal with in my practice. Men have heard that regular ejaculation is good for the prostate, and that's true to a point. Regularly emptying prostatic fluid reduces stagnation. which may lower the risk of certain infections and potentially prostate cancer over the long term. But that general statement gets misapplied constantly. More is not always better, especially if your prostate is already dealing with something. If you have benign prostatic hyperplasia, which is enlargement, if you have any degree of prostatitis, which is inflammation, if you're already experiencing urinary changes like weak flow, urgency, or incomplete emptying, then pushing daily ejaculation on top of an already irritated gland can make all of those symptoms significantly worse. The prostate needs time to refill and settle. When you don't give it that time, the inflammation feedback loop intensifies. What I recommend to many of my patients is 2 to 4 times per week. That frequency tends to support prostate function without overworking it. But again, this varies by individual. What matters is whether your urinary symptoms are improving or worsening. That is your signal. I want to pause here for a second. Because if you're experiencing changes in urination, pressure in the lower abdomen, or discomfort after ejaculation and you've been dismissing it as just part of getting older, I want to be direct with you. That is your body asking for attention, not punishment, not judgment, just attention. And this is exactly why I put together a resource specifically for men in this situation. The Medical Guide to Avoiding Mistakes that damage the prostate after 60 is available in the pinned comment below this video. It covers the specific habits that quietly escalate prostate issues over time and what you can start doing differently this week. Go check it out after the video. Now, mistake number 2, neglecting the pelvic floor. Men don't talk about this. I understand why. Pelvic floor is usually framed as a women's topic. But that framing has cost a lot of men a lot of unnecessary suffering. Your pelvic floor is a group of muscles, just like your back muscles or your calf muscles. It supports the bladder, the bowel, and sexual function. It contracts during ejaculation. It's involved in urinary control, and like any muscle group, it can become overtrained. When daily ejaculation happens without any attention to recovery and without any targeted strengthening, the pelvic floor can develop tightness, hypertonicity. That means it's chronically contracted instead of functioning fluidly. The result? Pelvic discomfort, reduced sensation during sex, weaker urinary control, sometimes pain that radiates into the lower back or thighs, and men almost never connect those symptoms to the pelvic floor because no one ever told them the pelvic floor was their concern to begin with. What helps? Rest days, not necessarily from all activity, but from the frequency and intensity that strains the muscles, and gentle pelvic floor exercises, not the crushing maximum effort kind. The slow, controlled, gradual kind. The kind that rebuilds strength without adding tightness. I cannot overstate how many men I've seen regain comfort, control, and confidence just from addressing this one neglected piece. Now here's something I want you to think about. We've talked about habit versus desire. We've talked about stress management. We've talked about the prostate and the pelvic floor. And all of those things matter enormously. But none of them come close to the damage done by mistake number 1. This is the one I saved for last, not because it's the rarest, but because it's the most common and the most overlooked. And honestly, it's the one I feel most strongly about. Mistake number 1, letting shame and outdated beliefs run the show. I need you to hear this as your doctor, not as a lecture, not as a motivational speech, just as a clinical fact. Shame is one of the most physiologically destructive forces a man over 60 can carry. When you feel shame, cortisol rises. Cortisol is your stress hormone. When cortisol stays elevated, testosterone drops. When testosterone drops, your energy drops. Your motivation drops. Your mood becomes harder to regulate. Your sleep gets worse. Your cardiovascular risk goes up. And the irony? Men who feel shame around sexual behavior often escalate the behavior to escape the shame temporarily, which creates more shame, which creates more cortisol. The cycle feeds itself. Most of the shame men carry around this topic was installed decades ago, by religion, by culture, by silence, by the generation that handled every awkward topic with the same strategy: pretend it doesn't exist. But here's the truth. Desire at 60 is not pathetic. It's not embarrassing. It's not something to be explained away or apologized for. It is a normal part of being alive in a body that still works. What is unhealthy is treating it as something dirty or weak or shameful. Because that shame, not the habit, not the frequency, not any biological mechanism we've discussed today, that shame is what quietly erodes confidence, intimacy, and quality of life in men over 60 more than almost any other factor I observe in my clinic. You are not broken for having desire. You are not immature for thinking about this. You are not weak for wanting honest answers. You are a man who has been through a lot, carried a lot, and you deserve to age without unnecessary suffering piled on top of real physical challenges. Let me bring everything together for you. Because I made you a promise at the beginning of this video, I said I was going to tell you what daily ejaculation actually does to the male body. And I want to make sure that promise is fully kept before you close out. Here's the real answer. Daily ejaculation can be healthy. It can support prostate function, cardiovascular health, stress reduction, and sleep. For men whose bodies are recovering well, maintaining decent testosterone levels, and experiencing no urinary or pelvic symptoms, there's nothing inherently problematic about daily activity. But daily ejaculation can also gradually wear you down. If your body is not recovering fully between cycles, if it's become a stress management tool rather than genuine desire, if your prostate is already inflamed or enlarged, if your pelvic floor is overtrained, or if the weight of shame is adding biological stress on top of the physical activity. The difference between those two outcomes isn't frequency, it's feedback. The single most powerful thing you can do starting today is pay attention to how you feel afterward. Not right after, hours after, the next morning, over the next week. Let your body tell you what it needs instead of overriding it with habit or ignoring it out of avoidance. If you feel strong, clear, and well-rested after your current pattern, don't change anything. Your body is telling you it's working. If you feel drained, foggy, irritable, or physically uncomfortable, that's not aging. That's a signal, and signals are fixable. Practical steps you can start this week. For 3 days, after any sexual activity, write down 2 things: how you felt emotionally and physically 2 hours later, how you slept that night. Just those 2 data points. That's it. After 3 days, you'll have more useful personal information than any general guideline can give you. If you're dealing with urinary symptoms, reduce frequency for 2 weeks, not permanently, just as a diagnostic. See if the symptoms improve. If they do, your prostate was signaling overload. Adjust accordingly. If you're using sexual activity to manage stress or loneliness, replace it once this week with something else. A walk, a phone call, a meal you actually sat down to eat. Not as a rule, just as an experiment. Notice the difference. And if shame is part of your story, try this. The next time the thought comes, instead of judging it, just observe it. You don't have to act on it. You don't have to feel bad about it. Just notice it without a verdict. That small shift in perspective is where a lot of healing actually begins. You are not too old to feel good in your body. That is not wishful thinking. That is what I watch happen with my patients regularly. Men in their late 60s, their early 70s, making small informed adjustments and coming back months later describing a quality of life they thought they'd already lost. Not because of some dramatic intervention, because they started listening. Aging is not a slow surrender. It's a recalibration, and recalibration requires information, not shame, attention, not avoidance, and honesty, the kind I try to bring to every single one of these videos. Now, if you've been paying attention today, you know that prostate health and sexual health are deeply connected in ways that most men don't fully understand until something goes wrong. And there's a piece of this conversation we haven't fully covered yet. Specifically, what daily habits outside of sexual activity are silently accelerating prostate problems in men over 60 right now without a single symptom to warn them. I already made a full video on that exact topic. It's appearing right now in the corner of your screen. I want you to watch it next, because what you learn there connects directly to what we talked about today, and it may be the most important 15 minutes you invest in your health this week. I'm Dr. Natalie Parker. Take care of yourself. Your best years don't end at 60, they get sharper.